Thank you. Today we have a panel from the Department of Veterans Affairs at the Spokane VA Medical Center. So at this time, I will let them introduce themselves and tell us how long they have been in the field of education.
Um, my name is Sharon Bradley, and I'm the Chief of Education. I think it's been about 5 years that we started education.
My name is Debbie Duncan. I'm a clinical educator here at the Spokane VA, and I've been in education in Spokane as an RN since 1994. But prior to that, I've had many years of education experience as a nurse in other arenas.
My name is Karen Sastier-Renner. I've been in education for approximately, if I add my years as a nurse educator at a community college, it would be a total of about 5 years here at the VA for a year and a half, and I also am a clinical educator.
And describe how you identify current trends and issues in the field of distance education or education technology.
One thing that we're developing is a graduate nurse residency program, and we're doing most of that via distance training. We'll be using the Blackboard platform, and it's all still in development, so nothing has been implemented yet, but that's what we're working on, to be able to capture the new grads as they transition into practice.
And what trends are likely to have a large impact on teaching, learning, or education over the next several years?
Yeah, I think one of the trends is, of course, the use of computers and webinars, and even in the process of educating the staff here at the VA, we'll be putting on more webinars to capture more staff.
Also, one of the big trends in education that's becoming more and more prominent is simulation training. That's a huge trend nationwide, and we are also starting a simulation program here at the VA. It's a great experience for a lot of the staff, because they like to actually practice the hands-on thing the hands-on skills in a simulation mode versus just reading about it, or oftentimes not having the opportunity to do some of the practice on an actual patient. So that's a huge program that we're slowly developing here at the Spokane VA.
One of the other trends in K through 12 and also higher education, and even in the community colleges, is the bring your own device, or the BYOD movement. Do you see that as being a trend in the federal agency or the VA? And how does that impact your educational programs here at the VA? Or do you have problems with students connecting to the system or the computer system with their own devices?
Good question.
We haven't done, to my knowledge, a bring your own device, but we have used the simulation mode concept along with VTEL. As an example, we have students or we have staff that work out away from the VA, that work out in our community-based outpatient clinics, and because there's such a great distance from the VA, it's difficult for them to come in and get some of the education classes that our regular staff are able to sit in on. So we actually had them do some online training for the didactic portion, and then for the actual hands-on portion, we did it via VTEL. So the instructors were here in Spokane actually checking them off on the hands-on skills via VTEL versus having them coming all the way to Spokane, and that's been working very effectively.
How long have you been doing that?
We just started that in the last 6 months.
6 months.
Since we had the equipment to do it. So
What factors do you consider when deciding to adopt emerging technologies for your organization?
I think prioritization and um, we really want things to be meaningful, and so if things make sense, if processes make sense, and the participants can see the benefit to them, the what's in it for me type of value, that's I think we look at it that way. We don't want to do something just to do it. We want to make it meaningful, and a lot of times that'll be with combinations. There's another the value advanced classes that we've been providing. They've started with partial face-to-face and then follow up with online training to get the completion for that. So that's going to be interesting to see how that all plays out too, to make sure that they're able to do both.
And what challenges are likely to have a large impact on teaching, learning, or education over the next several years?
I see some of the challenges. I deal a lot with students coming into the facility, trainees, all different types of trainees, undergrads, associate health trainees, and now residents. One of the big issues I see that's not just here at the VA is the number of students that are applying for these programs. There's like huge waiting lists to get into the programs, but many of the schools are increasing the number of students they're putting through the training programs. And at the school site, they've got large classes, but then a lot of the students need the hands-on clinical portion of the program, and it's so difficult to find good clinical sites for the numbers of students they're trying to put through. And I think that's going to be a huge issue, not just here at the VA, but also in the community nationwide. I'm seeing that as an issue, as clinical sites. Many of the clinical instructors that are willing to take students are very, very experienced and are wonderful instructors, but they're so busy with their own workload of patients they're seeing that many of them aren't given time, extra time to do training with the students, and they're unwilling to take the students because they feel they're not being fair to the student because they're not allowed, having the time to work with them and to mentor them and to precept them. So I think lack of clinical sites for students, all types of students, is kind of an emerging trend, which I think is going to affect a lot of the outcomes from the programs.
So do either of you see when the technology that's being utilized in the programs, do you think technology presents a challenge to the educators in the classroom?
I think many times the students, especially the younger students, are much better at the technology piece than the educators are, because they've grown up with it. And a lot of them, we've had to many times adapt how we train, based on the emerging technologies, because the students want to use the technologies to learn. They like doing distant learning many times because it's computer driven. They like to do a lot of the computer courses that we have now versus sitting in a lecture classroom type course. I think they like the technology. We're trying to learn the technology so we can, teach them, accommodate them.
So on another note then, do you think that there is enough professional development to equip educators to deal with technology in the classroom?
We have programs certainly that we can attend. If we get new technology, we all train on that, but it's an ongoing challenge to remember how to use it. So the students usually can tell us how to use it better than we can tell them, but I think it's a great opportunity for the students, because they, especially like I said, the younger students coming into the programs, they love the more technology, the better.
And one other question then, describe the ethical and legal issues that are of concern in your job.
Oh man, legal and ethical. I thought about this a little bit, and course, you know, ethical. It's hard to know if you're really reaching people sometimes when you're using the technology. I just got a book that I was going to start reading about, you know, how do you really connect with students online when you never see their face or their body language or, you know, any of that, or some just don't talk as much so that you can't really figure out what's going on with them. So, you know, that's one of the things. It's not so much legal. Can you think of a legal? We want to make sure, for example, we're improving our orientation for residents and for medical residents. And we just want to make sure that we're doing everything that we're supposed to do. And what we're finding is that some people do things different, you know, and so you'll get feedback from one person about, you know, the way to do it, and then from another about the way to do it, and it might not be the same. So it's not really a legal thing, but we want to follow the guidelines and make sure that we're doing all of the things that we should be doing.
I guess from an ethical standpoint too, if you're doing hands-on training with a student, whether they're here or even in a nursing program, you know, ethically, is it better to do a procedure on a real patient versus doing it in simulation in a laboratory setting? Because then you're not inflicting potentially extra pain, or do you know, is it better to learn to do IV sticks on a mannequin versus sticking real patients numerous times to learn the same procedure? I think that this is something that many of the nursing programs that I know of are facing right now. How much simulation is enough? And actually one of our local colleges, I know, or universities, is doing a large research study right now on simulation, clinical training done in a sim lab versus clinical training done at the bedside, and how much is enough. And they're basically determining, you know, on a large 4-year project, you know, to see if they can come up with an idea of what's most beneficial for the students versus taking the patients, you know, the actual patients into consideration. So.
That sounds like a wonderful venture. Also, in the field of education, we see that technologies such as Twitter and Facebook and blogs is emerging. Do you have that as an emerging technology here in the VA?
We really haven't here on that I'm aware of.
And one last question. What advice do you have for a future professional entering the distance education or educational technology field?
I think, you know, everybody has to become as familiar as they can with the computer and computer systems and programs that are out there. Just learning the programs and being ready for what you need to know.
And I think with the distance learning programs, a student that's going to do that versus go to an face-to-face program, they need to be really motivated, because you don't, you know, if you go to the classroom, you know, that day you feel like because of peer pressure and the instructor, you know, breathing down your neck, that you have to do, you know, the assignments. But I think on distance learning, it's if you're not motivated, you're going to get way behind because you don't have those same, you have requirements, but it's not like the face-to-face learning. So
Yeah, that's what I was thinking too. You have to be motivated, and you have to have your goals to know that you're going to get something out of the training that you're taking, because it is really self-directed when it becomes more technical usually. So, yeah.
All right. Well, I want to thank each and every one of you for participating in this assignment on today in this interview, and hopefully I'll be able to use you in future assignments.
Thank you.
Thank you.